The main concern in quality management in the hospital is patient safety. Infection control is an essential component in any healthcare facility. Registered nurse Tracy Bennett at Pomona Valley Hospital Medical Center tells us the primary role of infection control.
Our primary goal for infection control is to limit the exposure to infectious agents throughout the organization. So we want to make sure that we don't spread diseases from one patient to another between staff. Because it is a hospital, people come with infectious diseases to the facility. And so our primary goal is to make sure that we contain those illnesses to that specific patient while they're receiving treatment. One of the things we like to emphasize for the staff is that we are professionals that have worked with infectious, contagious diseases throughout our careers. And so what we want to do is really emphasize the basic training that we've always had. Hand hygiene, number one. Making sure that you wear the appropriate personal protective equipment. Making sure that we don't forget the protocols that we already have in place, being sure that we contain whatever illness to that specific area and that we don't contaminate other areas. We have CDC protocols, we have protocols that are in place from the California Department of Health, and we've always followed those guidelines. With Ebola, we just really had to make sure that we emphasized any areas that we weren't sure were in place. Also, one of the things we did was we did a lot of mock walkthroughs. We did tracers where we would go through and walk through our process and look for any areas where we were vulnerable. We looked to make sure we used the shortest path to get to the place we needed to go to, that we restricted our exposure to associates. So we have healthcare providers who have volunteered to be the first line. We provided additional training for those staff members who would be encountering those patients. And so one of the most important things that we needed to do was be able to identify the patient early. So when the patient arrives, we wanted to make sure that the staff members knew what to look for, so they would be able to identify the patient when they first entered the facility.
It's important to have this infection control at the emergency department and urgent care.
Our emergency department is definitely the first point of contact for most patients. So that was our first area that we prioritized. Our urgent care areas are also a point of contact. So our administration and our admitting and our registration clerks were also trained on how to identify a patient that might be at risk for Ebola exposure. The issue that we have in identifying a patient with Ebola is that the symptoms are very similar to the diseases that we deal with regularly. So flu-like symptoms, fever, vomiting are very common illnesses that come into the emergency department and urgent care all the time. The key was identifying the contact with outside travel to the affected areas. Things that can be very common for a healthy person: influenza. For a person who's healthy and young, it might not have an impact. For a person that's vulnerable, pregnant, it can be life-changing. So our goal is that we don't expose patients to any infectious agents, whatever they are.
What precautions can people take to help in the prevention of spreading infectious diseases?
One of the best things you can do to decrease the risk of infecting others is, if you're sick, stay at home. Don't go to work. If your children are sick, I know it's really difficult sometimes to get daycare outside of the regular facility. Don't take your sick kids to school. Getting your flu shot every year is very important, not just for you, but for the people you're exposed to. When you go to the grocery store, you might be perfectly fine having the influenza virus, but the person next to you in line could be very vulnerable and you can be a carrier.